Hi, my name's Emily. I'm an NHS doctor working in the mental health service at the moment, and I'm here with Naomi Brown, who's a social care worker.
Hi, I'm a support worker. I work at the Grange in Bookham with adults with learning disabilities in supported living. Yeah.
Brilliant, thank you so much. It'll be really nice to get your perspective on the vaccine and kind of just your experience really of how things have been with the pandemic. Would be brilliant. So we'll get started.
So I had COVID back in March, although I did get it again this February. So maybe you could explain why it's important, even though if you've already had it and feel you have antibodies, to have the vaccination.
Yeah, I think that's such a reasonable question because I felt the same thing. I had COVID back in March last year, exactly the same as you, kind of right at the beginning of the pandemic. And the fact of the matter is, like, as you've said, you can obviously catch it more than once, as you've proven yourself. Although, you know, we can test antibodies, we don't know how long immunity will last. We don't know how long those antibodies will last in our bodies. So the advantage then of having the vaccine is that you are then protected again for the future. And if you do go on and get COVID again, the vaccine can help prevent you getting really unwell and getting admitted to hospital. So that's why even if you've already had it, it's not a reason to not get the vaccine. You just need to wait for 28 days. So if you test positive, leave it at least 28 days before going to get your vaccine. But yeah, it's definitely important to still get it.
Okay, so obviously we've both had our first vaccination, but not our second one yet. I had very mild side effects, but I know a couple of people I work with, we've had conversations where they've had, like, not really extreme, but have been poorly for a couple of days. Do you want to talk a little bit about the side effects and what they can mean for different people?
It is normal after a vaccination that you can get sort of mild symptoms, maybe like tiredness, headache, maybe some muscle aches. And that's really just because your body is kind of mounting an immune response to the vaccine in order to give you those antibodies that you'll need to fight the infection later down the line. So it is completely normal that you can feel just a few of those mild symptoms. But having the vaccine doesn't give you COVID-19, and it's important to just remember that those side effects will be short-lived. Has anyone mentioned it to you at work, kind of the worries about fertility? Because it's something, I feel like it's one of those myths that it's just happens to just crop up on the internet. So it'd be interesting to know if you heard anyone kind of talk about it.
No, so no one's really spoken about it to me. It was just my first worry in general, because I think it's hard to imagine how they can test for fertility when the vaccines become aware to us so quickly. It'd be nice to hear your thoughts on that. There
has been a lot of myths. A lot of them have been sort of like promoted through social media, if you like, and lots of the kind of top scientists, doctors, you know, the Royal College of Obstetricians and Gynecologists, the Royal College of Midwifery. There's some recent guidance out as well from the Association of Reproductive and Clinical Scientists that are basically all saying to us that there is no evidence whatsoever of the COVID-19 vaccine impacting fertility. There's kind of lots of reasons for this, one of them being that there's no kind of logical link between a vaccine and your reproductive system. There's no kind of plausible biological mechanism really for how those two things would be connected. You know, that's why I wanted to have the conversation with you today, to kind of try and reach out and reassure people that these myths, there's just simply no scientific backing for it.
All support workers want to feel safe at the moment in what they're doing and their work. So it'd be nice to know why you think the vaccine is important to get.
I think obviously the main reason is that any vaccine is to prevent a disease. And obviously at the moment we've had to go through all the lockdowns and different kind of, you know, safety procedures to protect everyone because we don't have any herd immunity to the coronavirus because it's a new virus. So what the vaccine does is basically allows your body to create an immune response to the virus. So when you encounter it in real life, you don't get as unwell.
So what would you say to somebody who didn't think the vaccine was safe?
One of the worries is there's a perception that the vaccine was developed very quickly and, you know, is it therefore safe? And the truth is that the vaccine's gone through exactly the same safety procedures as every other vaccine that's been developed. The other thing to mention is that the independent medicine regulator, the MHRA, has looked at all of the data done during the trials for the COVID vaccine, and that included tens of thousands of people who participated in those trials. And they were completely satisfied that the data showed that there was no concerns about the vaccine, and they were happy for it to be rolled out to the general population. So Naomi, do you think you could tell me a bit about your experience of the vaccine, like how you found it and, you know, how it's been for the people that you work with as well. You did mention they were really excited.
Yeah, definitely. So we got sent a link from our managers actually really early on, and I got mine at Royal Surrey Hospital. You went straight there, they booked in your next one. So that's how all the staff got it. And then the tenants, we got a call on Friday saying we've got the whole weekend booked for you guys, bring your guys along at these times. And we had like buses going back and forth full of tenants, just getting them vaccinated and bringing them back. But I know you can also you can call 119, or you can just talk to your GP if you're not at a place that'll organise it for you. Like if you're at home or anything like that and you're an adult with learning disabilities, you can do it that way.
So how did you find it? Obviously you work with people with learning disabilities. Did you find there was kind of information available for them, like easy read information and things to be able to kind of explain the vaccine process to them?
They all got easy read vaccination invitation letters, so they were really useful for our guys to kind of get an idea of what the experience would be. I know you can also call, if you have like a special request for someone with a learning disability or autism, you can call the vaccine place early and get them to do that for you. Obviously reasonable requests, but yeah, it's really helpful, especially for people when jabs can be quite scary for some people, and obviously just the whole experience is quite different to what anyone's used to. But everyone was so welcoming and so lovely. It was really, really good, yeah. Oh, thank you so much for all your great knowledge. It's so reassuring to hear it.
Honestly, it's been so nice to chat to you and like to hear your perspective on it. Because when you're at work, you don't ever have the opportunity, really, do you? Because you're so busy, rushed off your feet. So it's nice to have the time to hear your opinion.
Thank you.
No, thank you so much.